Good afternoon, thank you for joining us. I'll start with the usual report on the daily COVID statistics. The total number of positive cases reported yesterday was 1,246. That is 16.2% of people newly tested and takes the total number of cases to 37,033. 440 of the cases were in Greater Glasgow and Clyde, 306 in Lanarkshire and 192 in Lothian. The remaining cases were spread across 9 other health board areas. I can also confirm that 397 people are currently in hospital, which is an increase of 20 since yesterday. 33 people are now in intensive care. That's 2 more than yesterday. And I regret to say that 6 additional deaths have been registered of people who first tested positive during the previous 28 days. And the total number of deaths under the measure used in these daily figures is now 2,544. Today's total, and indeed all of the deaths that have been recorded in recent days, reminds us and should remind us again that COVID is a virus that is deadly for some people, as well as being really dangerous for many others. This is not a virus that we can be complacent about or just allow to spread unchecked, however much we might wish it was. And I think that is an important point in the context of everything else I will say today. But let me at this stage yet again pass on my condolences to everybody who has lost a loved one to this illness. Now, there's a couple of points I want to update on today. First of all, let me report that 2 more walk-in testing centres have opened this week. A new centre opened in Old Kilpatrick in Western Bartonshire yesterday, and a centre is opening for bookings in Stirling shortly. We are continuing to work with the UK Government to increase the number of walk-in sites across the country, and several more, including centres in Dundee and Inverness, are due to open later this month. These add to the 5 walk-in centres that are already in operation, 2 in Glasgow, 1 each in Edinburgh, Aberdeen and St Andrews. These 5 centres that are already operational are within walking distance of student campuses and therefore will be especially useful for students. But I want to stress that all walk-in centres are open to all members of the public. You can book a test by going onto the NHS Inform website. As always, please don't use public transport to travel to a testing centre. If you don't have a car and you can't walk or cycle to a testing centre, please book a home testing kit through NHS Inform. And remember, because this is an absolutely crucial point for all of us to understand, that you must start to self-isolate from the time you start to experience symptoms of COVID. You mustn't wait until you get a test result before you start self-isolating. And that's a really important point to make sure that we are doing everything we can to break the chains of transmission. Now, my second theme today, as you would expect, relates to the new regulations which will come into force later today and tomorrow. The regulations applying to hospitality will take effect at 6 p.m. this evening. Those relating to other premises like snooker and bingo halls take effect tomorrow. They will all be in force until Sunday the 25th of October, in other words, across 2 weeks and 3 weekends. Firstly, and with the exception of 5 Central Belt Health Board areas that I'll come on to shortly, where tighter restrictions will apply, pubs, bars, restaurants and cafes will only be able to operate indoors on a very restricted basis. They can only open indoors from 6 a.m. to 6 p.m. for the service of food and non-alcoholic drinks. They can, however, continue to serve alcohol outdoors up to the existing curfew time of 10 p.m. In addition, hotel restaurants will be able to serve residents indoors beyond 6 p.m. but will not be able to serve alcohol. In all cafes, restaurants and bars that will remain open, the existing rules and meetings will continue to apply. So that means no more than 6 people should meet, and they should come from no more than 2 households. However, there is an exemption to these rules, and this exemption applies to all parts of Scotland for weddings that have already been booked and, of course, for funerals. And the current rules for these will continue to apply. As I indicated earlier this week, we are introducing stricter restrictions in 5 health board areas: Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley. I think you probably only need to look at today's figures to get a sense of why we have taken that difficult decision. I mentioned that there are 440 new cases in Glasgow today, 306 in Lanarkshire and 192 in Lothian. Numbers in Forth Valley and Ayrshire and Arran are lower than that, 53 new cases in Forth Valley, 84 in Ayrshire and Arran, but they are still very high for the population of those areas. And given that people live and work across all 5 areas, there can be a ripple effect between them, which is a further reason that tighter restrictions will apply to all 5 of these health boards. So in these areas, all licensed bars and restaurants will be required to close indoors and outdoors from 6 p.m. this evening. Though takeaways will be permitted, and there is again an exception for hotels serving food and non-alcoholic drinks to residents. Now, I want to address now a frustration about what I understand some see as a lack of clarity over the exemption for cafes, which are being allowed to stay open even in the Central Belt during the day as long as they don't serve alcohol. Now, the reason for this cafe exemption is quite simple. It's to give people, particularly those who might be living alone and also working from home, somewhere that they can still meet a friend for a coffee and a chat. And we judge that as important to help reduce the loneliness and isolation that comes with some of these restrictions that are in place right now. But, and this is the other side of this balance, we are deliberately trying to reduce the volume of places that people come together so that we can stop the virus spreading. So we've got to draw any exemption really tightly. So that's why we're not allowing premises like restaurants to decide to just stop serving alcohol, become cafes and stay open. That would undermine the purpose of these restrictions. But we did realise there was a potential anomaly for existing cafes that have an alcohol licence, even though serving alcohol is very, very incidental to their business. And what I announced the other day would have forced these cafes to close. And in some areas, particularly rural areas, they might be the only cafe in a village. So we decided to try to resolve this in a very targeted way. And in the 24 hours that we've been doing so, I readily accept that that has resulted in a lack of clarity. But sometimes that's the price we have to pay right now for trying to be as flexible as possible. It would have been much easier and would have given much greater clarity just to stick to the position yesterday that cafes with a licence had to close. But we decided to try to strike a different balance. But I can confirm that the regulations being published today, I think they have just been published before the briefing started, have a definition of cafe which applies regardless of whether or not they have a licence. And that definition is an establishment whose primary business activity in the ordinary course of its business is the sale of non-alcoholic drinks, snacks or light meals. Now, that's a definition based on what a cafe already does. It doesn't allow a restaurant to now turn itself into a cafe. And I think business owners will know whether their establishment fits that definition or not. But any doubts or questions that any have should be discussed with local environmental health authorities. Now, I know how tough this is, and I can't tell you how sorry I am to be standing here in a position where we are requiring some businesses to close again. I am desperately sorry for that, and I know how desperately difficult this is for people trying to make a living, keep businesses that they've worked hard to build up going, and of course take care of their staff. But all governments are trying to strike right now almost impossible balances between lives and jobs. And speaking for the Scottish Government, we are trying to do that as best we can. And as I've said all along, we will not always get it perfectly right, but we are trying our best to get through this as well as we can. Now let me turn now to the other Central Belt restrictions that will be in place for the next 2 weeks. Snooker and pool halls, indoor bowling alleys, casinos and bingo halls will close in those areas for 2 weeks from tomorrow. Contact sports for people aged 18 and over will also be suspended with an exception for professional sport. Indoor group exercise activities will not be allowed, although the current rules will remain in place for under 18s, and gyms and pools can remain open for individual exercise. And outdoor live events will not be permitted in these 5 areas for the next 2 weeks. And in general, we're advising people who live in Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley not to travel outside their health board area if they don't need to. And similarly, people in other parts of Scotland should not travel to those areas if they don't need to. That said, we're not imposing mandatory travel restrictions at this stage, and we're not asking people to cancel any half-term breaks that they might have, but we're asking people, if you don't need to travel, please don't do it at this stage. And finally, if you live in these 5 health board areas, please limit your use of public transport to essential purposes only, for example, going to school or work if you're not able to work from home. Now, I know that businesses who are affected by these temporary restrictions rightly want to know details of the compensation package that we're developing to support them for the next 2-week period. We intended to publish details on the allocation of our £40 million support fund this morning, but we are now expecting an announcement from the Chancellor later today on furlough, which might have an impact on our proposals. I hope they will have a positive impact on our proposals, so we will publish the details after we have clarity on that. And I would call on the UK Government to ensure that whatever it announces today on furlough applies in Scotland from tonight. However, I do want now to outline the 3 strands of the additional Scottish Government package. Firstly, support for employment. This was intended to top up the existing furlough scheme. However, it's this aspect that might be impacted, we hope positively, by the Chancellor's announcement later today. Secondly, we will give a cash grant over and above any employment support for each business that is being required to close or reduce their operations. This is likely to be at the same level as the support provided in Aberdeen when we had the local lockdown there, and that was, depending on rateable value, grants of either £1,000 or £1,500. And thirdly, we will make available a discretionary fund for local authorities to distribute to businesses that are in need of support but might not fall into the categories that I have already covered. As I say, we will publish details of that once we have the clarity on the first strand, which we hope to get from the Chancellor later on. Now, the restrictions which are coming into force today and tomorrow are significant. There is no way in which I can suggest otherwise. But the case numbers we've seen in recent weeks, including increasingly the figures now for people being hospitalised, show why these restrictions are necessary. We have to stop this virus from spreading, and having already restricted meetings between households in each other's homes, the most important additional step we can take is to restrict people meeting up in places like bars and restaurants. These measures still allow for some social contact in cafes, as I've already outlined, and they don't prevent people from taking the half-term holidays that they had already booked or from going ahead with weddings which have already been planned. We've tried to minimise the impact on your lives as much as possible while still doing as much as we need to do to get this virus under control. But for a period, and this is why, for a period of just over 2 weeks, we will remove some of the major opportunities the virus has to spread. And we do believe this can have and will have a significant impact on transmission. And so I know these steps are unwelcome, and believe me when I say they have been imposed with the greatest reluctance, but I would urge all of you to stick with them. The only alternative to restrictions like this right now is a continuing surge in COVID, which would take more lives and probably in turn require even tighter restrictions in the weeks and months to come. Now, in addition to the temporary restrictions which come into place this weekend, and this is the point I will end on, I would urge everyone to continue to stick with the existing rules and guidance. None of us should be visiting each other's homes at the moment, except for specific purposes like childcare. That's a really tough restriction, but it is perhaps the most important way we have of stopping this virus jumping from household to household. When we do meet outdoors or in cafes, the maximum group size is 6 from a maximum of 2 households. In addition, only car share if it is essential, work from home if you can, download Protect Scotland, the app, if you haven't already done so. And finally, please remember facts. Facts comprises the basic rules that if we all follow, take away the opportunities for the virus to spread. So face coverings, avoid crowded places, clean your hands and hard surfaces, 2 metres distance from people in other households, and self-isolate and get tested if you have symptoms. I know this is tough. I really do know this is tough, and none of what the government is doing right now is being done lightly. I do not want to be standing here imposing restrictions that limit the freedoms we all love and take for granted. But this is, as it was at the very start of this pandemic, about saving lives and keeping each other as safe and as well as we possibly can. We will get through this. It will pass. That much I do know. But I know it will pass easier and possibly more quickly if we pull together, stick together and look out for each other by doing all of these really important things. So my deep gratitude to all of you for that. Jason's going to say a word or two now before he and I take questions as usual.
Thank you, First Minister. On Wednesday, the Chief Medical Officer, the Chief Nursing Officer and I published an evidence paper in relation to these new restrictions. It gives me an opportunity to thank the analysts, the modellers, the scientists who every day help us with these data and analysis of what's going on with the pandemic in our country. But a particular thanks to them for the fast production of what became Wednesday's publication. I'm going to very quickly just outline some of the highlights. And these data are Wednesday's data and the data we had available to us that day, not today's. So the R number is somewhere between 1.3 and 1.7. The doubling time of the pandemic in Scotland is 9 days. So that means 1,000 cases today becomes 2,000 cases with no mitigation 9 days from now. We estimate there are 2,900 new infections per day. Remember, quite a lot of infections feel nothing or feel very mild symptoms and are not always tested. At this rate, with no further action, we will be at our March peak of new infections per day by the end of October. In the 7 days up to Wednesday, there were 1,728 new cases in Greater Glasgow and Clyde, 943 in Lothian and 825 in Lanarkshire. The Central Belt is responsible for around 75% of new cases. Across the whole of Scotland, the 7-day average rate is now 82.8 per 100,000. There were 18 deaths in the 7 days up to Wednesday, and there were 18 deaths in the previous month. The over 80s are up 60% in a week. The 60 to 79-year-olds are up 120% in a week. We've seen a 79% increase in admissions in a week. We've had 25 ICU cases, up from 10 2 weeks previously. The closest international comparison, and it's not exact, of course, is 4 weeks behind France and 6 weeks behind Spain, both of whom have implemented severe restrictions on their populations. On a 7-point scale for compliance, self-reported, 79% of our population report themselves a 6 or a 7, complete or almost complete compliance. So 4 out of 5 appear to be, by their own reporting, very, very compliant. 97% of the population reports not meeting in other people's homes. Consistently, over 20% of our Test and Protect interviews report an association with hospitality. That rises to 26% more recently. Hospitality already has a distancing exemption to 1 metre, and separating households, even at that distance, has proved difficult. In summary, following all these data and our investigations, our advice to the First Minister and the Cabinet was that without further action, new infections were likely to continue to increase to levels that would put our National Health Service and our population at risk. First Minister.
Thank you, Jason. I'll move straight to questions now. Gordon Cree from STV.
Thank you, First Minister. You might remember some years ago there was a famous court case about whether a Jaffa cake was a biscuit, something to do with VAT. But do you fear that we might be going down a similar legal path now? Because there are a lot of people in the hospitality industry who say defining what is a cafe, what is a restaurant, is very difficult. What you might get as a all-day breakfast in a cafe is substantially less light than a main meal in a gourmet restaurant, for example. Does that kind of difficulty cause confusion and anxiety for business, but confusion for the public in understanding where they can and can't go? And can I also ask Professor Leitch if having rules that require explanation and clarification takes away from the core purpose of trying to save lives?
Thanks, Gordon. I would not have guessed before today that you were older than me, but I don't remember a court case about Jaffa cakes, unfortunately, but I will look it up if I get a moment. And in my humble opinion, a Jaffa cake is definitely a biscuit, but there you go. That's probably one of the more controversial things I've said, and a brief attempt at humour in an otherwise difficult time. Look, all of this is difficult, and I say that just because it is a fact. There is nothing easy about what anybody is doing or having to cope with right now, and we're not in normal times. Whenever the Jaffa Cake court case happened, no doubt that was something that was given rise to by a decision a government would have taken in normal times. These are not normal times. No government wants to be taking these decisions right now, and you know, and it relates, I'll let Jason answer the question himself, but it relates to your question to Jason. It is, if people want 100% clarity about these things, and I get that, then the only way we can give it is just to say everybody closes. The reason that some lack of clarity emerges is because we're trying to be as flexible as possible, because this balance that I spoke about yesterday, lives in this hand, jobs in the other, is really difficult to strike, and we're trying to strike it in the best way we possibly can. So where there is a clear anomaly, as in the cafe situation, we're trying to resolve it, and it's not perfect. I readily accept it's not perfect. But for cafes, is it better that we have that than just a blanket closure for those with a licence that wouldn't feel fair either? And that's why we've come up with the definition that we have today. We live in a democracy, a rule of law based democracy. Any business, any individual can consider things from the perspective of their legal rights, and I would not stand here and suggest that anybody shouldn't have the ability to do that. What I would say, to put all of this into context though, is firstly, these are restrictions that we have put in place for 2 weeks. I know businesses would prefer those 2 weeks of restrictions weren't happening. I get that, but they are temporary restrictions that if we all put our shoulder to the wheel on, hopefully can arrest this rise in cases and avoid the necessity for greater restrictions or longer restrictions later. And secondly, and this is where it is different to the decisions that governments would usually take that would give rise to businesses wanting to take us to court, you know, because governments decide for policy or ideological reasons to do something that affects a business that businesses don't like and want to challenge legally. That's not the position we're in right now. I don't wake up in the morning wanting to close down pubs and restaurants. Believe me, I would give anything not to be in this position right now, but I am, and I carry this responsibility, and I'm trying to discharge it to the best of my ability. This is a global pandemic of a horrible virus that can kill and make people seriously ill. We've got to try and stop it, and there are limited things we can all do to try and stop it. We've restricted people's ability to interact in other people's homes. The other settings that people are most likely to come together are in places like bars and restaurants, and therefore that is the other way in which we can try to reduce the volume of people coming together. But nobody wants to be doing this. And my sympathies, and I know they want more than sympathy, are with the businesses affected. If I thought there was an alternative, trust me, I wouldn't be standing here doing this right now. But this is for the greater good of all of us. And I would ask businesses thinking about legal rights to bear that in mind right now. And I suspect it's not a decision for me, but I suspect we'll see similar action being taken in other parts of the UK over the next few days. And we've already seen in Ireland, Brussels, in Belgium, parts of France, including Paris, Berlin right now. All of these countries, and no doubt many more that I've not mentioned, are introducing restrictions on hospitality for the simple reason is that it is one of the key ways of keeping people from mixing in environments where the virus is likely to spread. So it's tough. It's horrendously tough. I know that. But we have no alternative right now, and I'm afraid that is just the reality.
Clarity of rules, Gordon, is of course important, but the First Minister's correct. As you open, every country in the world struggles to find the sweet spot between the clarity of message and trying to open business, economy and society. And the instructions, I'm afraid, get more complicated. We have tried to be as simple as we can. Our facts campaign, our constant press briefings, our constant, appearances on your programme and many, many others to try and get across to the public by phone-in, by Radio 1 interviews, by Young Scot videos, as much as we can about why and what of the restrictions. Now, as we do new things like we've had to do this week, and we've had to do them quickly because of the numbers I just read out, yes, that clarity is really, really difficult to achieve. It'd be much easier to go back to the 23rd of March and have a stay-at-home order and shut all the businesses. That's much clearer. But it is not appropriate for this stage of the pandemic or for keeping the balance between those things the First Minister just illustrated. So we try our best to get those messages and that clarity across as best we can.
David Henderson from BBC.
Thanks very much, First Minister. You talked there about the need for clarity, but across the Central Belt, a cafe which serves light meals will get to stay open, and a licensed restaurant serving light meals must close. Isn't that a very artificial distinction and very unfair to all concerned? Maybe in the interests of clarity, just explain, if you would, what is the actual difference between a cafe and a restaurant?
Well, I think most people who go to a restaurant and have a meal with wine and alcohol and go to a cafe for a coffee where they might have a bite to eat as well know that distinction. I think business owners will know that distinction. If there are doubts, if there are premises on the margin of that, they should discuss that with local environmental health authorities. Look, if people want clarity, it is not an option. Let me go back to a fundamental here. We are trying to reduce the volume of places right now that people can come together and pass the virus. That's the objective. It's not an option, therefore, just to exempt large groups of premises. It's not an option to say, OK, restaurants just stop selling alcohol and stay open, because that would leave too many premises where people can come together and defeat the purpose of what we're trying to do. There's a volume thing here. So if people want clarity and certainty and a level playing field, we would have to go in the opposite direction and say, right, all cafes have to close as well. It's because we've tried not to do that. Firstly, to give people just somewhere that they can still go to avoid the loneliness and isolation that we know is a growing problem, that we said, OK, let's keep cafes open. And then we've tried to deal with what is an anomaly and unfairness for cafes. So we're trying to do this to balance that horrendous balance we're trying to strike as well as we can. But if people want, unfortunately, in this situation, the more clarity that people want, the more that takes us in the direction of being harder rather than more flexible. So, there are judgments to be made here. But if we simply said to all restaurants, stay open as long as you don't sell alcohol, we're undermining what we're trying to do because there are too many places where people are still coming together. This is not easy for anybody. I know that. But what I would appeal to people to do is keep, and I know, before I say this, I know if you're a business owner, faced with closing your business, worrying about how you're going to pay your staff, I know, I feel it in my heart as well as my head. I know how this must be horrendous for you. But this is all part of this bigger picture of trying to control this virus. And therefore, we're having to do things that none of us want to do. And I would simply appeal to people, even if you fundamentally disagree and hate what I am doing right now, at least try and remember that I'm not doing it because I want to harm you. I'm doing it to try to keep people safe and strike that balance as best I can. Lewis Warner from ITV Border.
Thank you, First Minister. Although you've told hospitality venues in the Central Belt to close completely for 16 days, some businesses elsewhere, like the south of Scotland, say they've had no choice but to do the same as well. They say it's simply not viable for them to operate during those restricted hours. I wonder if that's something you'd considered might happen or perhaps expected to happen. Also, if infections are still rising in 2 weeks' time, is that an indication that hospitality isn't the cause, and therefore would you ease the restrictions, or will this be a reason to keep them in place for a bit longer?
These restrictions that come into force tonight are in place for 2 weeks, and I've been very clear about that. Obviously, we monitor the virus on an ongoing basis. It may be that after 2 weeks, we don't yet see the full impact, but we believe these will have an impact that will then reduce infections, at least reduce the rise in infections and have an impact on hospitalisations and ICU. My answer to your broader question is similar to my answer to David. Yes, I understand that for businesses outside the Central Belt that are allowed to stay open on a limited basis, that limited basis may not be enough to prevent them closing at all. And I understand and regret that. But it was not an option to do nothing in these other areas. We've got a particular problem right now in the Central Belt, but it's wrong to say that there is any part of Scotland where this virus is not a risk. Orkney and Shetland right now are the only two parts where it's not rising, but they've had cases. Western Isles has had a very serious outbreak, and there's a rising incidence of the virus in every part of Scotland. So we had to do something in these other areas. And it comes back to you try to give as much flexibility as possible. But if people say, we don't like that balance because it's too confusing, the situation we're in right now means that the only thing we can do is go to the harder end. We can't ease up anymore, because easing up more allows the virus to spread and undermines what we're trying to do. So I keep saying this. I know how difficult this is. I hate every aspect of what we're doing right now, with every fibre of my being. But there's no alternative, because if we don't take these steps, and as I say, I strongly suspect other parts of the UK will be doing it before too long, I'll be standing here in a week, in 2 weeks, in a month's time, and the numbers that I'm reading out today for people dying will seem like nothing compared to what I'm reading out then. And I don't want to do that if there is things we can do to stop it. I still, it's not that long ago that I was standing here every day getting asked questions that, the debates I will probably have in my own mind about some of this will go on for the rest of my life about, should we have locked down earlier in March? Might that have, saved a few people? Now, we did what we thought was right then, but we know that we have to act quickly with this virus to try to get ahead of it, because if you let it get ahead of you, then it takes people's lives and it makes people ill, and I don't want that to happen if we can avoid it. Jason, do you want to say anything?
Probably an answer to David and Lewis. It's important to say this is not just an alcohol problem we're trying to solve. Public health is about volume of opportunities for the virus to spread. It's not an individual problem. It's a population problem. And therefore, you have to reduce the overall opportunities for the virus to spread between households. That's why the restaurant cafe thing is so important, because we've got to reduce the number of times people come into contact with other households. Now, that's up to us, human behaviour, but it's also up to the restrictions that put in place to try and make that easier for people to stay apart. That sounds like the reverse, of course, of such a bad restriction which affects businesses, affects human beings, affects employment. I completely understand that. But it is to reduce the number of times the virus can find ways of spreading.
Thanks. Peter Smith from ITV.
Thank you, First Minister. Just to clarify to Gordon Cree's point there, in 1991, a court ruled that a Jaffa cake was indeed a cake. So you can see there's a lot of confusion and ambiguity over that. But I'm currently...
Jaffa cakes are going to get us through this pandemic, so it's been an entertaining side note.
Yeah, but I'm currently sitting in...
I don't know where you are.
Till 6 p.m. is non-alcoholic. I'm currently sitting in a cafe, a business by day. Until 6 p.m, the primary activity here is light meals and non-alcoholic drinks. After 6 p.m, they move on to alcoholic drinks and heavier meals. It's in your constituency. Now, with the problem that they're saying is that with less than 6 hours to go, you're still defining whether they can stay open or have to close. They are none the wiser. Is this now a shambles with jobs on the line?
No, so I've got a good idea where you are actually from seeing it, but I'm not going to mention the name of the place, but I think I can probably guess, and it's somewhere I like very much. Look, my advice to the premise, whether it's the one I think or another one, is talk to the local environmental health. We are defining this as well as we can. But if any premise thinks they want greater clarity, my only advice I could give is close, because I can't say to wide ranges of business stay open, because that will defeat what we have to do here. So I know this is difficult. We're trying to give as much flexibility as possible. But if people want us to come down firmly on one side or the other, it will be on the side of closing, because that is the only way we can make sure we are doing what these restrictions are designed to do. So cafe, I think most premises will know which side of that definition they fall on. If there are those in doubt, have that conversation today with the environmental health and make your judgment based on that.
They would love to stay open, but they have to brief their staff, they have to realign the business, and they've got less than 6 hours now.
if a premise is in doubt, they should close unless an environmental health officer tells them that they think they fall within the definition. Now, if cafes are finding this difficult, then the only alternative we will have is to say anybody with a licence should close. This, if there is a lack of clarity, it has come from us trying to be more flexible. And that's, I think, the right thing to do. But that doesn't mean we can give a blanket go-ahead to all classes of restaurants to stay open. Because if we do that, then what we will find is that we don't have the effect from these restrictions that we must have. And that, I'm afraid, is the bottom line. Alan Smith from Bauer.
Thank you, First Minister. West Sound has spoken with businesses and organisations on Arran who are struggling to find any explanation as to why they face the toughest of the new restrictions, despite not having a COVID case for months. Visit Arran says people on the island are shell-shocked and devastated. Can you provide an explanation as to why Arran's been grouped in with parts of the Central Belt? Given the decisions are made, obviously, on a health board level, is it not possible to separate Arran perhaps from mainland Ayrshire when it comes to these types of decisions?
Okay, again, on a lighter Jaffa cake type sort of point, I know plenty. I grew up in Ayrshire. I'm Ayrshire born and bred, and I know that many people in Ayrshire don't like being grouped in with the Central Belt. Generally, we want to be Ayrshire, not the Central Belt. So I have had some representations, including from within my own family, about describing Ayrshire and Arran as part of the Central Belt. We're trying to describe this as much as possible. But the more serious point here, and the more serious answer to your question, I addressed this in Parliament yesterday with Liam MacArthur in the context of Orkney, but obviously it applies, the same general argument applies to Arran. If we are to exempt islands from restrictions, then there is a debate to be had there. I readily accept that, but it would come with other trade-offs. So if we were to say, Arran, you don't have to have these restrictions, the pubs can stay open, the restaurants can stay open, we would have to put travel restrictions on, because otherwise you will just get people taking the infection to Arran. It's a bit like New Zealand on the other side of the world. Everybody says, rightly, New Zealand's managed to eliminate COVID, but the way it's done that is to effectively seal itself off. You can't get in and out of New Zealand. So in a smaller and different scale here in our own circumstances, that would be the argument with islands. If you want to exempt islands, you have to have that associated with travel restrictions. And I think there is a genuine debate there that islands themselves have to be included in about whether they think that is better than restrictions. But right now, if we think we have a problem in Ayrshire and Arran, and people can go to and from Arran freely, as we want them to be able to do generally, then we risk taking the infection there. And if pubs are open there, then it's spreading more quickly. So there are, every country and every part of every country right now is having to make trade-offs to keep this virus under control. But as I said yesterday, in relation to Orkney, the Islands Minister has already had discussions with islands and will continue to have that dialogue about the trade-offs and the balances that we might be able to strike in future. Tom Eden from PA.
Thank you, First Minister. Good afternoon. Following on from Jason Leitch's stats, the quite alarming sort of rise in cases among the elderly, I was just wondering at what point are you going to have to reintroduce shielding for certain vulnerable groups?
I'll hand over to Jason on this point. We don't want to introduce shielding, and we will try everything to avoid it, because it puts a disproportionate burden on those in the shielding category. The most extreme isolation and the loneliness and the impact on mental health, I think, is such that we want to avoid doing that. And that's why I am one of these people that, and I think the majority are in this category, I don't think we can deal with this virus just by sealing off one section of our population and letting everybody else just go about their normal business. I don't think that's practically possible, because we don't live in that kind of segregated way. But I don't think that's ethically right either. We have to collectively get through this pandemic. So actually, one of the reasons why those of us in the younger, healthier age groups are being asked to forego visits to pubs right now is to try and avoid the virus getting so out of control that the more older and vulnerable groups have to go into this kind of really extreme isolation again. It's about all of us shouldering a bit of the burden and pain of getting through this situation. And I think that is the better approach if we can possibly keep to that. We obviously want people generally, but particularly in the shielded category, to be very informed about the risks in their own areas so that they can make decisions themselves about that level of risk they want to take, which is why the information we now give about infection levels at very local areas is so important. And if you haven't already looked at that, you can find it on the Public Health Scotland website. Jason.
Shielding was a very blunt tool that we used in March when we were using a lot of blunt tools. We've learned a great deal about this virus. We've learned a great deal about the at-risk groups of this virus. And that blunt version of shielding is something we want to avoid. There is a 4UK clinical committee, and our Scottish representative is the Deputy National Clinical Director, Dr. John Harden. He sits on that with representatives from each of the 4 countries, and they look at those at-risk groups and give us advice about what we should do depending on the prevalence. We know, for example, that heart failure is a risk. We didn't think it was in March. We know that the biggest risk of all is age. The next biggest risk is obesity. So we learn all the time about which groups need protection. And if we have to do something to those groups, then we won't hesitate to do so. Just now, we think it is an individual risk assessment by their clinical teams. I spent yesterday afternoon with 50 families, virtually, looked after by the Children's Hospice movement in Scotland. Mums, dads, carers, kids, about this very point, them wanting to get their kids back to school, wanting to be able to go and see people in care homes or have people visit them in their gardens. And each of those individuals has a different story to tell. It is not a blanket approach to each of those 50 families. And it drew into stark relief how difficult this has been for those families, many of whom were shielded for 5 months. Something we really want to avoid if we can, but equally we want to avoid the virus in that population.
Thanks. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Just returning to the new regulations of May, you referred there to firms maybe trying to get some more clarity or advice from their local environmental health. But obviously, a lot of councils, their officers are working remotely. They won't actually be at their desks. I mean, how are firms meant to get this guidance if they need it? Are they just simply going to have to shut up shop like's been suggested?
Look, environmental health departments are working and people should contact them. What I'm about to say is hard and tough, and I recognise that. But if you are a business asking yourself the question, am I really a restaurant, then perhaps you should be on the side of closing for the next 2 weeks. I wouldn't be standing here having this conversation and being pressed about lack of clarity if I'd just decided to stick to the initial position yesterday and say, if you've got a licence, you have to close. The price you pay for trying to introduce a bit of flexibility is that people then say there's no clarity. And you know, I still think it's better to try and give a bit of flexibility at the edges. But if that leads to too much confusion, then it has to go in the other direction. Because I come back to the point I keep making, that this is about, and Jason made it a moment ago, it's about volume as well as just alcohol. We have to reduce right now the number of places people are coming together and the virus is getting the opportunity to jump from household to household. And you know, that's just a fact of how we are living right now. And I hate it as much as everybody else hates it. But unfortunately, I have to take these tough decisions to try to avoid a mounting toll of people becoming ill and dying from this virus. Chris Musson from The Sun.
Hi, First Minister. Just 2 things. You may have seen the scenes at the bar on Sauchiehall Street in Glasgow where people were crowded outside watching the Scotland penalties through the window. It would be good to get your take on that, should that have happened. And secondly, we've heard from that the authorities, including the Scottish Government, are considering if it could be necessary to cancel the Old Firm game on October the 17th in case of the risk of people gathering together in houses, especially given pubs are closed. So can I check, is this a possibility? Will you rule out cancelling the game? Or do you think it should go ahead?
At the heart of both of your questions, Chris, and they're both fair and legitimate questions, is an assumption that I can't trust the majority of people to behave responsibly in a global pandemic. And I want to be able to say ultimately the government has a big responsibility here to put in place the overall protections that we deem necessary. But ultimately, we're going to get through this or not, depending on how responsibly all of us act as individuals. So if I can take your first question, I saw pictures of what I think you're describing to on social media this morning. Should that have happened? Every day I stand here and read out the A of facts that says avoid crowded places. So no, it shouldn't. Of course, it's slightly less risky if people are outside than inside, but you shouldn't be in crowded places. And I can't be everywhere, even the police can't be everywhere. We have to rely on people's personal responsibility to some extent here as well. And I should have started by saying congratulations to Scotland for the victory last night. It was never in doubt, obviously, although we all sweated through the penalty shootout, but fantastic result that I'm sure gave everybody something to feel cheered about. But it comes down to this personal responsibility, ultimately. And on the Old Firm match, again, we have to be able to have a degree of trust in people that pubs are closed for a reason and house parties are being prohibited right now for a reason, to stop an infectious virus spreading. So please don't have a house party just because you can't go to the pub. We're all having to live with really difficult restrictions right now to keep each other safe and to try to avoid people becoming ill and dying. It's horrible not to be able to go and do what you love doing. For me, that wouldn't necessarily be going to a football match, but there are things I enjoy doing that I can't do just now. There's things all of us enjoy doing, from visiting our families to football to, going out for a meal with friends at the weekend. We're all having to make sacrifices right now. They're horrible. They get more horrible with every day that passes, but don't forget why. Because if we don't make these sacrifices right now, more people will get COVID, more people will get ill from it, and more people will die. And government can do so much here. We are the ones with the primary responsibility to keep the country as safe as possible. But we all have to take some responsibility for this. And so don't go to crowded places and don't have a house party just because you can't go to the pub. For this next couple of weeks, we're all being asked to make that sacrifice for the greater good of the health and well-being of the country. And I appeal to people, however frustrated, however angry, we are all starting to feel these emotions, I know that, but however we feel those emotions, don't lose sight of why all of this is necessary. If we don't do it, more people will die than will otherwise have to be the case. Do you want to say any more about football?
Chris?
Sorry, Chris, did you want to?
Yeah, I just wanted to just double check on that. I mean, just on that point about the Old Firm game, will you rule out cancelling the game? Or
well, I don't. It wouldn't be my decision whether the Old Firm game was cancelled or not. I certainly have had no discussions about cancelling the Old Firm game. I would really like football on the restricted basis it is having to operate just now with no fans and stadiums to go ahead, because it's good that folk who can't be in the pub and can't be having house parties, they can at least watch their football team on the telly. So I want these things to go ahead. And there's certainly no plans, as far as I'm aware, to cancel the Old Firm match. But it comes down to, can everybody just be responsible in how they watch it? And it, I can't regulate everybody's individual behaviour. I can't babysit the whole country, nor would you want me to. But I appeal to everybody's sense of responsibility right now, and appeal to people not to forget why we're doing all of this. Jason, did you want to say any more?
There's been some engagement with the football authorities, Chris, but not about the Old Firm game. There's no intention for us to ask for it to be cancelled. There's been some engagement this week around the protection of players, self-isolation of players, and looking after them and their loved ones. That's been the principal role with our engagement with football this week. Football is happening, and it's that balance again between what the society is allowed to do and open at the same time as keeping it safe. So I would underline the First Minister's plea that people don't take advantage of the fact there's an Old Firm game to then break the rules and put themselves, their loved ones and the whole population at risk.
Scott McNabb from the Scotsman.
Thank you, First Minister. Can I come back to something Professor Leitch said in his opening remarks when he was talking about compliance? Because the evidence paper the government published earlier this week did nonetheless suggest that fewer than half of Scots, 38%, were not fully complying with the COVID guidelines, including 1 in 8 who said they didn't comply with the meeting rules, whether that's rule of 6 or the households. Now, compliance may never be absolute, but are you satisfied these levels are sufficient, or are you looking to take further action to address this?
I said in Parliament earlier in the week that over the next 2 weeks, so you remember that this 2-week closure of hospitality is to try and arrest the rise in infections, but also buys us a bit of time to address other things that we need to do for that to be effective longer term, and certainly working to try to address areas where we think compliance with the existing rules and guidance is not high enough. Now, I think the majority of the population is still really trying hard to do the right things, but it gets harder for all of us to do the basic things that we're being asked to do, and we need to constantly remind people why it's important. And some of the things that few of us, relatively speaking, will have been asked to do so far, but more of us may be asked to do, like self-isolation. That is really difficult to be asked to self-isolate for 2 weeks if you've been exposed to the virus and been a close contact of somebody with it. So that's why we're putting in place additional support to help people do that. So we will be looking very carefully at how we persuade people to raise the compliance levels with some of the really important aspects of what we're asking them to do, because it is really important. The more we all, if you think about how we deal with this virus, it's about what bits of population and society take how, what element of the strain of it. In March, we put everybody into strict lockdown. So, lockdown, and all of us as individuals were taking the strain entirely through that. Now it's a bit different. Test and protect is taking a lot of the strain because it's catching cases, tracing contacts, telling people to self-isolate. We are now having to put a bit more emphasis for a period on closing pubs and asking people not to mix in each other's houses to take a bit of the strain. But a lot of the strain can be taken by all of us doing the basic things to stop it spreading, washing our hands, wearing the face coverings, staying away from crowded places. The more we all comply with that, the more of the strain of this will be taken by those measures, and the less we'll have to rely on other things. So we need to get compliance rates as high as possible. But it's not easy. So it is really important for all of us for people like me and Jason, to constantly be explaining, reminding people, and giving as much support as possible for people to do it. Alistair Grant from the Herald.
Hi there, thanks very much. Just to check, given the confusion over the cafe-restaurant distinction, how do you expect this to be enforced? I think Mr. Leitch said yesterday that local authorities and environmental health officers will have to make judgments over what constitutes a cafe or a restaurant. Do you expect environmental health officers to go around checking whether those businesses that remain open are in fact cafes, serving light meals under the definition given in the regulations? And given the confusion over the rules, will businesses that accidentally flout them or stay open be given some leeway? And just to double check as well, I think you did touch on this earlier, but if a restaurant sells mostly snacks or light meals for the next 16 days, functions as a cafe in the ordinary course of its business, I take it you're saying that it can't remain open, it can't do that.
If you're a restaurant right now, and remember we're talking here about a relatively small number of premises at the margin of this definition. Most restaurants know they're restaurants. The vast majority, if you're a restaurant right now, you can't convert into being a cafe, because part of what we're doing here is trying to reduce the volume of places that are open for people to mix. And if you're a cafe with no licence, you can stay open in the daytime hours. There is a class of premises here that are cafes but with licences that initially we would have required to close, and actually it would be a lot simpler and we'd have no accusations of confusion if we just said, okay, they have to close, but we'd have a lot of accusations of unfairness. So we've tried to fix it. And it's a small number of premises relative to the overall hospitality sector. And I think even there, most will know what side of the definition they're on. And I would ask people, difficult though it is, if you're an owner of one of these businesses, do the responsible thing. If you think actually you're on the restaurant side, then close. For many, it will be really obvious. And yes, if there are any in that marginal bit, then environmental health officers, if they feel a premise is flouting that, will have the responsibility for addressing that along in some circumstances with the police. So none of this is easy. I keep coming back to this. Clarity is easy, but it's hard. And maybe in some respects we've got to be harder so that we can be clearer. But when there's really glaring anomalies and unfairnesses, we try to be flexible. And then we get hit with, it's all really confusing and not clear. And you know, hey, I accept that. But that's the price sometimes we pay for trying to get a bit of flexibility. I know people are really frustrated, and you can probably hear in my voice, I'm frustrated right now as well with all of this. We're all trying to do our best. I know cutting politicians and governments and people who advise governments some slack is not the normal thing people like to do. We're all really struggling through a difficult position right now, and we're trying to do our best. And sometimes we get that right. Most of the time, hopefully we get that right, but sometimes we don't, and we're just trying to strike the best balances we can. Daniel Sanderson from The Telegraph.
Thanks, First Minister. Just to follow up on your response to Alice's question, you suggested sort of environmental health or police could play a role if a restaurant sort of breached the rules, but surely under the letter of the law, for example, a tapas or a sushi place could reasonably argue that they fit this definition. So could there actually be any powers to shut them down, or are you just relied on the goodwill of them to do the right thing as you see it? And can I also just check with Professor Leitch? You spoke at the start about the proportion of people who tested positive who went on to the test and trace, went on to find there was an association with a hospitality venue. What does association actually mean? Does that just mean they happen to visit one, or is there some evidence that that's where they picked up the virus? Thanks.
When I refer to the police have a range of powers under these regulations, and they are set out in the regulations themselves, and you know, people can see what they are. So there are powers of enforcement, there are penalties if people breach these regulations, but we also try to, when we're talking about guidance, it doesn't have enforcement powers, but even when we're talking about regulations that do have enforcement powers, I'm trying to appeal to people's sense of responsibility right now, and that applies to businesses as much as to individuals. I know how horrendous it is for businesses to be facing closing down for 2 weeks, but it's for a reason. It's not because a big bad government has decided we want to harm hospitality. Nothing could be further from the truth. It's about trying to stop the spread of the virus and avoid a much tougher situation in all different ways for all of us later on. And we're making financial support available to businesses to help them with the impact of that. So if you're in any doubt, then then take the decision to close, would be my advice. If you feel it's so marginal that you can't decide yourself whether you're a restaurant or a cafe, then perhaps err on the side of caution. And you will get the financial support then that comes with that. So we're trying here to be as flexible as possible, as I say, and sometimes that means there are around the edges not as much clarity as people would like, but if people want 100% clarity, sometimes that means being a bit harder on the definitions that we use. Jason, do you want to answer the second question?
Two things, Daniel. I think you probably know the first answer. You can't know for sure where people caught the virus. That's impossible. You can often be surer if they're related to a cluster in a workplace or in a hospitality sector where there's a number of positive cases. Test and Protect has to interview, sort out the infectious period of the individual, usually 48 hours before symptoms, and analyse where they have been and what they have done. We know that places where people have less distancing, more crowds and mixed households are more risky. That's just the nature of this virus. And there is research coming up all the time. There's a US paper published yesterday that suggested hospitality was a key risk factor in a lot of the infections in that particular paper. So there isn't any doubt that the hospitality environment in general is more risky than some others. That's not universal. And even with mitigation, you can't remove that risk entirely. But I cannot tell you for sure that the 26% of people caught the virus in the pub they said they visited. Of course I can't.
The one thing I would say, just to assure people, as Jason said, it would be a lot easier for people like me if there was direct causation between somebody getting the virus and where they got it on every, because then you could be absolutely sure that what you were doing was going to succeed. But we're not making up this association with hospitality. In the last 24 hours, I think I've heard the Health Secretary in England, the Chief Medical Officer in Ireland, the Chief Medical Officer in Wales, all talk about the association with hospitality. And I wish it wasn't so, but it's about where are people more likely to come together. We know in our own homes, that's the biggest risk. We've restricted that. And the next biggest opportunity are in settings like bars and restaurants and pubs. So there is logic behind what we are doing, even if you can't always say person X definitely got it in restaurant Y. Common sense as well as science also comes into the judgments that we are arriving at.
Sorry, can I just come back on your response to my original question? I'm just still not entirely clear. So if a sushi restaurant or a tapas restaurant says they want to stay open because they fit this definition, can you stop them or not?
I don't think a sushi or tapas restaurant would fit that definition, in my view. But you know, again, you know, we're trying to be as clear as possible while having some flexibility. If you're a restaurant, if you market yourself as a restaurant, if you're a restaurant, then you're not a cafe. You're a restaurant, and that should be what guides your decision. Rachel Watson from the Daily Mail.
Thank you, First Minister. You've spoken a lot about giving flexibility to businesses and has led to a lack of clarity. But it was just 6 hours before the new restrictions came in that you offered a definition of a cafe. Has that delay not caused significant confusion and stress for businesses?
We're doing everything as quickly as possible with really short notice right now because we're dealing with an infectious virus. This is not a normal decision-making process where you have the timelines and the luxury of timelines. We have to do things quickly, and I know that causes difficulty for people. So, you know, maybe you know, having seen all the reflections about confusion and lack of clarity, maybe we shouldn't have decided to have flexibility. We should have said if you've got a licence and you happen to be a cafe, you have to close and tough. That's just the way it is. But we for the right reasons, we tried to introduce a bit of flexibility. Actually, as it happens, I still think we're right to do that. And I think most businesses, certainly most restaurants and most cafes I've frequented, will know what side of this definition they are on, particularly if we're all acting in that sense of trying to do the right thing for the right reasons. So it is inevitable that the more flexible you try to be, the less clarity you can give people. And that's, you know, if people want clarity rather than flexibility, I will take that into account in decisions in the future. But I still think around the edges, giving people a bit of flexibility and avoiding glaring anomalies is the better thing to try to do. But remember, we're trying to reduce the volume of places that people can come together and get this virus. And you're the last question, Rachel, so it's probably as well to end just with this. This is, you know, if we were standing here having a conversation because I, for reasons that I can't quite imagine what they would be right now, had decided in normal times as a First Minister that I wanted to, you know, close down a section of hospitality. You know, I didn't want people to go to restaurants and enjoy themselves. This would be a very different discussion. I don't want to be doing any of this. But like countries all over the world right now, these are unavoidable decisions to try to get this virus and keep this virus under control. And we're making those decisions as best we can so that they have the desired effect, but where we can, have flexibility. I said this in Parliament yesterday, and I think I've said it today. All of the decisions the Scottish Government is taking right now, and I think this is true for governments across the world, and this is what it feels like every day. You've got lives in one hand and jobs in the other hand, and you're trying to strike the best balance. And it is horrendously difficult for decision makers, but more so for the people who live with the consequences of the decisions. We're trying to do it as best we can. But don't forget why we're doing it, because if we don't make these tough decisions, this virus will run unchecked, more people will die, and even younger people. You know, go on to social media and read the accounts of young people with long COVID who are still 7 months after having it, living with horrendous health consequences. I know there's I think it is a minority of scientific opinion right now who says, just let it run riot, it's no worse than flu. Actually, statistics published yesterday showed that it is a lot worse than flu. That is not a view that I could take, because this virus is dangerous and we should all try to avoid getting it, and we should all try to avoid transmitting it to others. And that's why we're taking these tough decisions. Jason, do you want to say anything in conclusion before we wrap up?
Briefly, perhaps we focused a lot on the restrictions. Perhaps we should go back to why we're doing these 16 days. These 16 days are absolutely crucial Don't find ways of reaching the edge of the restrictions. Find ways of being inside the restrictions easily and safely. Just simply don't mix households if you can possibly avoid it. Don't travel unless you have to. Stay close to your home unless you have a holiday pre-booked. And when you go, try and stay local to where you are. These 16 days are literally about saving lives again. And we're going to keep going back to the numbers that rise, and we've got to get them down. So these 16 days, although we've discussed the intricacies of the restrictions, it's crucial that we spend these 16 days as a whole population getting the prevalence of coronavirus down.
Thank you. And these restrictions are tough. They will help do what Jason has just said, but let's also try, hard though it is, not to lose sight of the fact that we do have many more freedoms now than we did back in March, April, May. You know, back then you couldn't go to the shops apart from supermarkets. You know, you were being told to stay at home. We do have more freedom now, even with the virus, than we had back then, and we should exercise that responsibly. We've asked shops to reintroduce some of the mitigations from earlier in the pandemic, including 2-metre distancing. This is really difficult, and I know, because I feel it myself. I'm the First Minister, I'm standing here doing my job, but I'm also a human being and an individual citizen. I feel the frustration and I feel the fatigue that everybody feels with this, and we all want it to be over, and it will be over sometime soon. I can't give you a date, but it will be over, and it will be over quicker, and it will be over with an easier journey to that point if we all look out for each other and do the right things, however difficult they are, and continue to be understanding and kind to each other. Everybody, in different ways and to different extents, are going through really tough times just now. So let's remember we're all in it together, albeit our experiences are different. So please, please stick to these rules. Try to do it, all of us, with as good grace as we can find at the moment. And remember, it's nobody's fault. This is a global pandemic of a horrible virus. It's nobody's fault, but we can't escape it. So we have to get through it in the best way we can. So please, stick to the restrictions. Household gatherings, don't go into other people's houses. To businesses affected by these temporary restrictions, I'm sorry you're having to close your doors at 6 p.m. tonight. I couldn't be sorrier. I believe that, no matter how angry you are at this, believe that nobody wants to be doing it. And please, everybody, remember facts, face coverings, avoid crowded places, clean your hands, clean the hard surfaces, 2 metres distancing, and self-isolate and get a test if you have symptoms. If we all stick together, I promise you we will get through this. It won't be easy, it won't be pleasant, but we will do it. Thank you all very much indeed. I will see you back here again on Monday, and thanks to Rachel for our BSL interpretation as well.